Hello and welcome. I'm Dr. Kathleen Pace Murphy, Project Director of the Houston Geriatric Education Center. Welcome to our community lectureship titled Wisdom, Jewels, and Myths of Healthy Aging. This presentation would not be possible if it were not for the generosity of the Health Resource and Service Administration of the Department of Health and Human Services. This grant was initially funded in 2007 with renewed funding for 5 years beginning in 2010, and our grant number is UB4HP19058. We really have two major objectives today. We'd like to talk to you about 6 ways to enhance successful aging in your life and also debunk some myths about healthy aging. And we have 7 myths that we would like to address. How we age is determined not just by our genes, but how we live. So here's some jewels to live by. So let's talk about our first jewel, exercise. We know that exercise helps to prevent many things. For example, diabetes. We know that physical activity improves insulin sensitivity, glycemic control, but it also decreases risk factors for cardiovascular disease, such as high blood pressure and high cholesterol, and can actually reduce your risk of coronary artery disease. We know that exercise helps your body to metabolize medications better. We also know that starting exercise at any age is good for you. For example, there was a research study that was done that showed that in people 70 years of age and older, if they walked regularly 2 miles per day, they were less likely to develop Alzheimer's disease than those who walk less than a quarter of a mile. Well, why would this research show that? Well, in early studies that they've done, they've shown that exercise has been shown to reduce the level of amyloid. And amyloid is the sticky protein that clogs the brain, if you will. It increases oxygen and glucose delivery to the brain by increasing blood flow. It's right now the only intervention that we know that is protective for the brain against cognitive impairment. There was a study that was conducted that involved 16,000 nurses from age 70 to 81 years, and they found when looking at this group of 16,000 nurses that those nurses who walked leisurely 1.5 hours per week did better on mental function tests than nurses that were less active. So one of our jewels to you today is this: you need to treat exercise like a job or an appointment. Schedule it every day and make it a job to do it, because the long-term effects are certainly important. Remember that exercise at any age can help strengthen your heart, lungs, and lower your blood pressure. Exercise can improve your muscle tone and strength. It actually decreases your chance of falling. And emotionally it helps you as well because it decreases depression. Exercise is important. Well, let me give you some other reasons why I think it's important. Dr. James Levine of the Mayo Clinic has come up with a new saying: sitting is the new smoking. We are going to start encouraging people to stop sitting. Well, what's that all about? Well, in his book, Get Up, published in the summer of 2014, he explains the harmful effects of excess sitting and how increasing your NEAT, N-E-A-T, non-exercise activity thermogenesis, can help improve your health. Well, what are some examples of NEAT? Well, it can be things like getting up and walking to the bathroom, standing at line at the bank or at a store, walking to and from your car in parking lots. Activities that put together represent burning of calories associated with your daily activities. Dr. Levine points out 34 diseases and conditions that are associated with excessive sitting. Diseases such as diabetes mellitus, hypertension, cardiovascular disease, obesity, increase in cancer risk, depression, increase in back and joint pain. We're in a terrible epidemic right now. We know that 35% of American adults are obese, and this number is supposed to hit 50% by 2020. Can you imagine that? 50% of American older adults are going to be obese, and all we have to do is get up and stop sitting. Standing up, and better yet, walking is better for humans. Move, move, move. It's the mantra and the cry that we're making to our older adults. We know that exercise is so important to a successful and healthy aging. Are you up to it? Let's get up and start moving. Let's talk about our second jewel. Food is medicine. Food is medicine. That's right. Think about some of the things that we've heard in the news lately. The Center for Disease Control says that 33% of older adults have one or more type of cardiovascular disease. Several studies have been published that show that diets high in fruits and vegetables or vegetarian type diet are effective at reducing almost all controllable risk factors for heart disease. That includes things like your total cholesterol levels, your LDL, and remember LDL stands for the lousy fat that we don't want high in our bloodstream, diabetes, and of course, obesity. There's a lot of research that we could go over, but I thought I'd just point out a few studies that would be important. First of all, let's consider a randomized controlled trial. There were two diets that were researched. Diet A was low-fat diet with few vegetables, legumes, and whole grains. Diet B was a low-fat diet, but it was a plant-based diet consisting largely of vegetables, legumes, and whole grains. Well, what were the results? Well, interesting enough, both diets had a significant reduction in that lousy fat, the LDL, and total cholesterol. But Diet B, the diet with low-fat, plant-based diet consisting largely of vegetables, legumes, and whole grains, showed greater overall reduction of cholesterol by 17.6 milligrams per deciliter, and for the bad fat, the LDL fat, by 9 milligrams of deciliter. Now, reductions with diet change can happen quickly, especially with cholesterol. There was a study that was done where they randomized 3 groups of people with moderate to high cholesterol. Now, the control group just ate low-fat dairy and whole wheat cereal. Intervention group number 1 had the same diet of low-fat, whole wheat cereal, but they also gave them a statin. And if you recall, statins are drugs that actually lower the cholesterol. Then the other intervention group had a diet high in plant sterols, soy protein, fiber, and almonds. So what do you think the results were? Again, significant decrease in cholesterol was seen in only 2 weeks, with reductions at 4 weeks in lousy fat, the LDL levels, at 8% in the control group. And remember, the control group was the group that had a low-fat dairy and whole wheat cereal diet. The group that had the intervention with the statin had a decrease in 31%. Isn't that amazing? Well, what about the group that didn't have the statin, but they had a diet high in plant sterols, soy protein, viscous fiber, and almonds? Their reduction was 29%. So if you're a person in the community that can't tolerate statins, this study is really positive for you. You don't have to take statins. You can use your diet to actually decrease your LDL and your cholesterol as well. So numerous studies have shown that these plant-based diets can in fact affect your lipid levels if you eat them and you're consistent in eating them and eating well. Not convinced yet that food is medicine? Let's take a look at 2 big problems that we see as we age: blood pressure and diabetes mellitus. We know that diets rich in fruit, vegetables, low-fat dairy, and less saturated fats have been shown to be beneficial in hypertension. And here's an example from the New England Journal of Medicine for your review. Changes in blood pressure, just like with your lipids and cholesterol, can happen fairly quickly with dietary modification. Let me give you a couple studies to consider. In a study of older adults, 459, they spent their first 3 weeks of a controlled diet that was low in fruit and vegetables and dairy products, which is pretty much consistent with the United States diet right now. For 8 weeks after that, 50% of them, or 229 people, followed a diet that was rich in fruits, rich in vegetables, while the other group had a combination of diet of fruit and vegetables, low-fat diet, and reduced saturated fats. So what were the results? Both groups had lower systolic and diastolic blood pressure in 8 weeks. And in the combination group, the group that combined diets of fruit, vegetables, low-fat dairy, and reduced saturated fats, their systolic blood pressure, that blood pressure at the top, that top number, dropped by 11 points, and the diastolic number, which is the bottom number of your blood pressure, by almost 6 points. And what's interesting about this study is nobody lost weight. Their body weights were maintained over the 8 weeks, so the reduction could not be linked to weight loss. It was linked to the type of food that they were eating, because food is medicine. Still don't believe me? Let's look at diabetes. We know from multiple studies that vegetarian diets protect against type 2 diabetes mellitus and metabolic syndrome. It improves insulin sensitivity in people who already have diabetes. 2 sources are given you here, both from the magazine called journal called Diabetes Care. Well, maybe you don't think that 459 people is enough people to convince you that you need to change your diet. So let me suggest a couple of these studies. The first study involves 22,434 men and 38,469 women. And these people indicated that they adhered to a vegetarian diet. So what this researcher did is they compared them to people who were not vegetarians. The results of this study indicated that people who follow a vegetarian diet lowered their risk of developing diabetes to approximately half, almost 50%, than that of non-vegetarians. The risk was less also for people who followed a lacto-ovo-vegetarian diet, meaning they included eggs in their diet, or a pesco-vegetarians, people that just ate fish as a protein in their vegetarian diet. Now, important in the study was they adjusted for their BMI, their lifestyle, and social economic factors, and still, people who were vegetarians developed the risk of diabetes half of what non-vegetarians do. There have been other studies that have looked at people over 30 who are not vegetarians and have found that they have a significant increase in insulin resistance that can lead to diabetes. And other multiple studies that look at the hemoglobin A1C, which is a level of looking at blood sugar over a 3-month period or the lifetime of a red blood cell. And they found again people who had vegan diets or vegan diets with low fat had a much less risk of developing diabetes mellitus. All right, you're sitting there saying, there's no way I'm going meatless. This chick's crazy. Well, if food is medicine, I'm not asking you to completely give up meat, but maybe there's things that you can do right now today to start changing your diet to make food medicine in your life. I have put up a couple references for you that is worth just going and browsing. The Vegetarian Resource Group guide, and also the Mayo Clinic's Nutrition and Healthy Eating page. One of the things that we haven't talked about, but if you've listened to some of our other community lectures, you've heard us talk about the fact that small changes as you get older make significant differences. And this is the same theory that holds true when you make little differences or changes to your diet. You will see big effect later on down the road. So let's think about some things that you might be able to do to make food more of a medicine. In your world. Well, let's consider number 1. How about reducing the amount of red meat intake you have per day? Every day, just eat a little less red meat. Well, you're saying to yourself, well, what difference is that going to make? Just maybe taking one small portion of red meat out of your day. Well, let me share a study with you. And this study was talking about and looking at reducing your meat consumption and substituting other protein for red meat. This was a prospective study, so they studied the people from the point that they made the changes. There were 37,698 men and 83,644 women. And what they found was, by reducing a portion of red meat a day, they actually decreased their cardiovascular mortality rate by 7 to 19%. What did they do? They replaced one serving of red meat a day with the serving of fish, poultry, nuts, legumes, low-fat dairy products, or whole grain, just once a day. Are you willing to almost reduce your cardiovascular mortality risk by 20% a day just by doing one simple thing? This study, which the key author was Pan, was published in the Archives of Internal Medicine in 2012. What was really interesting in this study is that if substitution was in place of processed red meats like bacon and hot dogs, the effect was even greater. Researchers estimated if participants had consumed less than a half a serving of red meat per day, premature death could have been prevented in 9.3% of men and 7.6% of women. All right, you love red meat and you're saying, Dr. Murphy, there's no way I'm giving up my red meat. All right, let's look at an alternative. Do you think you could maybe increase your fruit and vegetable intake to 5 servings a day? There are a lot of studies that show a linear association between increasing your fruits and vegetables up to 5 servings a day and decreasing your chance of coronary heart disease by 17%. Well, what kinds of fruit and vegetables are you asking me to put in my diet? Things like citrus fruit, green leafy vegetables, foods that are rich in beta-carotene. Those kinds of foods we're asking you to put in your diet. So you have 2 choices here. 1, just decrease your red meat intake by 1 portion a day and substitute it with a different type of healthy protein, or increase your fruit and vegetables up to 5 servings a day. Your heart will thank you for it. Okay, I've given you 2 jewels so far. I told you that exercise is important, and we talked about food as a medicine. But again, one of the things you're probably asking yourself is, does this stuff really make a difference? And the answer is, yes, it does. Let me share with you a trial called the Lifestyle Heart Trial. The Lifestyle Heart Trial, the principal investigator was Dr. Ornish, and this was published in The Lancet back in the 90s. This was a 1-year trial, and the intervention group was put on a strict, low vegetarian diet, moderate exercise, they stopped smoking, they did stress management. The control group just continued on every day in their normal lives, but they were given medicines for their therapies. Well, what was the result after a year? The experimental group, compared to the control group, had the following results. Angina, which is a pain that you have in your heart, those symptoms decreased by 91% frequency. The duration of that heart pain decreased by 42%, and the severity of the pain decreased by 28%. Their total cholesterol decreased by 24.3%, and that lousy fat that we've talked about decreased by 37.4%. The degree of coronary artery stenosis, and what that means is that the arteries that feed the heart to help it keep pumping become narrow, stenotic. It's almost like if you think about one of the pipes of plumbing in your home, that it gets a lot of crud in the middle and it just narrows and narrows and narrows. This intervention of strict low-fat vegetarian diet, moderate exercise, smoking cessation, and stress management actually changed that pipes, those coronary arteries. And what it did was, that degree of coronary artery stenosis was averaged and actually decreased from 40% to 37.8%. That's amazing. That diet, exercise, stopping smoking, and controlling your stress actually showed some reversing of coronary heart disease. It changed health and functional status in the experimental group. But the question you really need to be asking is, what about that group that just continued on and they took their pills, their medical therapies? How did they do? Well, some sobering statistics. The control group's angina symptoms, that heart pain, increased by 165%, 165. The duration of their angina increased by 95%, and the severity of the pain increased by 39%. And how did their coronary artery stenosis do? Well, not like the experimental group, theirs actually increased from 42.7% to 46.1%. So exercise plus diet actually does make a difference. Now, before we go on to our next jewel, I just want to mention a few things because maybe this is your first time joining us in our community lectureships. There's some principles of geriatric care that are really important to know, and I want to mention these as we move on to some of our next jewels. The first thing to remember is that when people get older, how they present their diseases change. Oftentimes you have atypical presentations. You might not get a temperature when you have an infection. Instead, you might fall or you become confused. So as we get older, know that how you present disease when you're sick is atypical or different than when you present it when you were in your 30s and 40s. As we get older, the second principle is that function is much more important to us than diagnosis, because function keeps us in our home and keeps us able to actually age in place. One of the things that's important is that as we age in place, we want to be able to maintain our independence as long as possible. And as healthcare providers specializing in geriatrics, one of the things that we do is with medicines, we start low and go slow. And one of our other mantras is we don't just do something, stand there. Because you present disease in an atypical manner, we're going to watch you and try to figure out what's going on in your health that would be causing you to fall or causing you to have cognitive impairment or, in fact, changes in your thinking. In geriatrics, acting hastily is more likely to do harm than not acting at all. And a slow medicine approach is our ideal. So let's go on to some other jewels. Okay, Jewel 3, say no to drugs. It's a myth that if it's over-the-counter drug, it must be safe. And there's multiple examples to prove that. Drugs such as Benadryl may cause memory, hearing loss, constipation, and dry mouth. Motrin or ibuprofen, if taken for too long a period of time, can lead to kidney failure or stomach bleeding. Myth, as we age, more is better. In 2011, persons older than 65 comprised only 13% of the United States population, but they consumed 33% of all prescription drugs. So how many drugs are too many? Anytime that someone was on one medication that they don't need, that's too many. Once someone is taking 8 medications or more, you can be sure that at least 2 of those drugs are fighting against each other or interacting with each other. In pharmacological research, they've shown that in 1 year, the average older adult with 5 or more chronic illnesses, I know people say to me, well, that's an awful lot. Well, you think about someone that's 70 years of age. If they have hypertension, high cholesterol, high lipid levels, diabetes, and most likely atherosclerosis, you've just gotten 5 diagnoses very quickly. So in this research, it showed if a person has 5 or more chronic illnesses, they will see a physician 14 different times in 1 year. And they will make 37 physician office visits with those 14 physicians, and they will have 50 prescriptions filled on average. Isn't that amazing? Adverse drug events are the primary cause of more than 10% of hospital admissions by older adults. So saying no to drugs and saying yes to only appropriate drugs becomes very important. The American Geriatric Society in 2013 has a wonderful website called info@healthyaging.org. And on their site, they have the Beers criteria, which is a list of drugs that are good for older adults and drugs that are not so good for older adults. This is a list of 9 top drugs that they talk to you about, talking to your physician. Should I be taking this medication? Is there another medication that I might be able to take? Could we look at a non-pharmacological approach rather than these drugs? Now, you're not to stop these drugs. This is a conversation that you have to have with your physician. But let me just point out to you some of these drugs that you want to have a conversation with your healthcare provider about. So let's start with non-steroidal anti-inflammatory drugs that are often called NSAIDs. NSAIDs can increase the risk of indigestion, GI ulcers and bleeding. It can increase your blood pressure, affect your kidneys, and make your heart failure worse. Now, short-acting NSAIDs like ibuprofen are better choices than long-acting NSAIDs such as indomethacin or Feldene. Now, if you're listening to this program today and you're over the age of 75 and you have a history of ulcers, you need a prescription of medicine to protect your GI system. Something like Prelisac or Cytotec might be ordered by your physician if you have to take NSAIDs. Also, NSAIDs can increase the risk of bleeding if you're taking medicines such as aspirin, Plavix, Pradaxa, Persantine, warfarin, or sometimes known as Coumadin. We try to avoid the drug called digoxin or Lanoxin. It can be toxic in older adults and people whose kidneys do not work well. So again, this drug is often needed in certain medical conditions, but have a discussion with your doctor about why you're on this particular medication. Avoid certain diabetes drugs such as glyburide and Diabinese because they can cause severely low blood sugars in people that are older. We like to try to avoid muscle relaxants when we can, drugs like Flexeril, Robaxin, and Soma in older adults. And the reason for it is that muscle relaxants in your age group can leave you groggy and confused. It can increase your risk of falls, cause constipation, dry mouth, and oftentimes problems with urination. We try to avoid certain medications too for anxiety and insomnia. Drugs such as Valium, Xanax, Librium, Ambien, Sonata, Lunesta. If you've been reading the newspapers of late, you've seen that the Federal Drug Administration has actually changed the dosing and prescribing of some of the insomnia medications. And the reason we try to avoid them again is this increased risk of fall, confusion, not remembering what you've done, especially with the insomnia medications, while you were taking this medication. Again, have a discussion with your physician. There might be some non-pharmacological mechanisms to help you sleep better at night. We try to avoid certain anticholinergic drugs. Drugs such as that are used for sometimes irritable bowel syndrome like Bentyl or overactive bladder drugs. These drugs as well can cause confusion, constipation, problems with urination, blurring vision, low blood pressure. And if you're a man with an enlarged prostate, it should be particularly cautious in using these drugs. If you have surgery and you're in pain, one of the drugs we try to avoid in people over the age of 70 is Demerol. Demerol has been shown to increase the risk of seizures and confusion in older adults. Avoid certain over-the-counter drugs, OTC, over-the-counter, and especially drugs, as we previously talked about, that have antihistamine effects and use Benadryl, or drugs that might be used for flu and seasonal cough because they can cause confusion, blurred vision, constipation, dry mouth, and problems urinating. Now, if you are not being treated for psychosis for a certain mental health disorder, we ask you to have a discussion with your physician about avoiding the use of antipsychotics. Antipsychotics have a clear place in certain medical conditions. But if you do not have that problem, talk to your physician about why you're on that particular drug. Drugs such as Haldol or Risperdal, because they can have significant adverse events in the older population. So let's continue with say no to drugs. Fact. Drug research often do not include persons over the age of 65 in their clinical drug trials. Fact, the number of hospitalizations decrease when polypharmacy is controlled. When your healthcare provider conducts a medication review of all the medications you're on and keeps you only on the medications you need, we know that this affects your health long term. Always ask your physician, nurse practitioner, physician assistant why a medication is necessary and if there is a non-medication treatment that can accomplish the same goal. We have given these community lectures for 7 years, and during this portion of our talk, one of the questions that usually comes up with is, what about vitamins? Should I be taking vitamins? Well, again, you've seen over the past 6 months a lot of research that's come out about vitamins, and is it in fact helpful to be taking a multivitamin a day? What we're seeing right now with the current research is that there's been efficacy shown in certain medications or certain vitamins and minerals, but not in all. We know, for example, that the Ocuvite medications, the vitamins that are specifically for eye diseases, have been shown to have a high efficacy and are absolutely a great drug to take if you have those different eye diseases. We've seen research in the omega-3 fatty acids that have shown that there's a decreased risk of coronary artery disease, a decrease in triglycerides, some symptom relief in rheumatoid arthritis, inflammatory bowel disease. But with those omega-3 fatty acids, they're just like other medications. They can have adverse events. So you have to watch for diarrhea and nausea, bleeding, especially if you're taking anticoagulants and antiplatelets. The other thing is the omega-3s can actually increase one of your liver enzymes called the ALT level. The other thing is you can't use these in people that have seafood allergies, or they should be used with great caution. Coenzyme Q10 has been shown to be beneficial in cardiovascular disease and also for people that are taking statins. They have shown some benefit with people with musculoskeletal disorders and also in people that have type 2 diabetes mellitus. Adverse events also occur with coenzyme Q10. That can include abdominal discomfort, headache, nausea, and vomiting. It too can increase bleeding, especially in patients that might be taking anticoagulants or antiplatelets. It has been shown to be a caution to use with people who have hepatic impairment. It may decrease your response to warfarin or Coumadin, and one small study showed that it can further decrease your blood pressure if taken with antihypertensives. So there needs to be caution in people that are on antihypertensive medicines. Vitamin D has probably been one of the vitamins that has been studied significantly. There's a strong inverse association with vitamin D concentrations in cardiovascular disease, glucose metabolism, and also in falls. So the lower your vitamin D level, the higher the risk of your fall. One of the largest studies that we've seen on vitamin D and hypertension was published in 2014 by Dr. Elina Hyponen in The Lancet. And what she looked at was people with high vitamin D levels to see if it lowered blood pressure and lowered the risk for hypertension. She evaluated over 150,000 people in Europe and North America and found that every 10% increase in your serum 25-hydroxyvitamin D level was associated with a decrease of 0.24 millimeters of mercury in your diastolic blood pressure, and that overall there was an 8.1% decrease in risk of developing hypertension. Last time that we looked, there were over 35 studies that have been published that indicate an association with cardiovascular disease and mortality related to adequate vitamin D levels. The thing that you have to watch for in all the vitamin studies is that many of these are causal associations, and we need more research in the areas of randomized controlled trials. Let's talk a little bit about religious participation and socialization. Research has shown that religious participation and socialization will improve your mental health and your ability to cope with chronic illness. We have seen in research that it decreases depression, anxiety, marital discord, and drug abuse and suicide. A book recently published by the Pew Research Center in Washington, D.C. called The Next America pointed out some really interesting work related to religious participation and socialization. Right now we know that more than 50 million people, it's actually a record, are now living in multi-generational family households. And these connections and interactions are a very important part for a healthy and successful aging for older persons. They are engaged in the family day-to-day living, taking responsibility to care for children, grandchildren, and they're actively participating in the day-to-day life of a family, of a social group, which decreases social isolation and loneliness. We also see in the religious research that 83% of the baby boomers, 83%, are affiliated with religion, while only 16% are not. And in the 85 and older group, 90% are affiliated with religion. So there's an importance there that has shown through the research of improving mental health and decreasing many of the symptoms of mental health, such as depression, anxiety, and suicide. Jewel number 5, recognizing the signs of delirium. As I spoke about a few slides back, older adults often present atypically when they become ill, especially with things such as infection, myocardial infarction, a heart attack. They can either fall or they will develop confusion. And one of the things that's important for you as an older adult, or if you're listening to this to know about your parents, is that sometimes older adults, when they get sick, develop signs of what we call delirium. Delirium is a temporary disorder of mental status that is characterized either by agitation, delusion, or hallucination, or it could be where a person becomes very quiet and not interacting. So you can have hypoactive delirium, where a person becomes very quiet, is not attending to what you're saying, or can be very agitated, have delusions and hallucinations. It's a sudden onset of symptoms, and it can happen over the course of a few days and may signal a very serious acute illness, as I mentioned, such as infection, heart attack, electrolyte imbalance, or an adverse medication effect. Symptoms may include a sudden change in mental status, sleepiness, lethargy, sudden irritability, garbled or slurred speech, or a fall. Usually this problem can be corrected and the person's mental status returned to what it was before the delirium. Family members and friends should recognize the signs of delirium and contact their healthcare provider or go to the emergency room immediately. Subtle changes in mental status over time may signal dementia or depression, but delirium is an acute onset and it's a medical emergency and you really need to act immediately. So let me give you a little acronym, if you will, of delirium, and let me just go through with you what each of the letters could mean when you're trying to figure out if something's wrong. Well, D out of delirium stands for drugs. Remember, drug adverse effect becomes more common as one ages and as one adds on more medications to their medication review list. Always try to figure out if a new drug has been added to your parents' or to your own medication list. Electrolyte abnormalities. This is something that has to be done by a blood draw, but will help your healthcare provider figure out why your loved one is having delirium or yourself. So D is for drugs, E is for electrolyte abnormalities, L is for lack of drugs. Perhaps your loved one's forgotten to take their drugs, or they're withdrawing from a medication that they're on. I stands for infection. And first place we look is at urinary tract infections and also respiratory infections. R stands for reduced sensory input. If people are often socially isolated or they're in the hospital and they don't have their hearing aids or eyeglasses on, they can actually experience delirium. So get mom and dad's hearing aids in and put their eyeglasses on and see if it makes a difference. I, intracranial problems. It could be a stroke, it could be a brain tumor. So I stands for problems with the brain. U, urinary retention and fecal impaction. And then M, myocardial infarction or a heart attack or metabolic problems related to diabetes or maybe thyroid disease. Next, let's talk about the third age. As we've developed from babies, our first age is educating ourselves, learning about the world, book knowledge, building on our careers. And as we enter our second age, this is the age where we start raising our family, developing our careers, establishing ourselves within the community. Many of us, if you're watching this over the age of 65, are now into our third age. What should we do once our family is grown and we retire? Most importantly, how can I make a contribution? Think about becoming a volunteer. Maybe it's a second career. But think about what you can do to make a difference. In a mission-driven life, it's important for us as we go through our life review as we age to figure out what kinds of contributions, what kind of memories do we want to leave people in our lives with. And this is the time for you to think about that. We often counsel people who are getting ready to retire to have these discussions and these thoughts before they retire. What are you going to do? Who are you going to interact with? How are you going to make a difference? Next, I'd like to talk with you about myths of aging. And I'd like to first turn to Emily Dickinson, who said, "We turn not old with years, but newer every day." One of the biggest myths we deal with is when people come in and say, "I'm supposed to feel old, I'm over the hill." And normally what I hear, especially in my clinic, is, "Doc, I don't feel old. I feel like a young person inside." And one of the things we have to recognize if you're a healthcare provider is that healthcare providers are often very biased. We often see the sickest of the sick, the frail older adults, and often assume that everybody that's over the age of 65 is not feeling well and having different kinds of disabilities. And that's absolutely false. We know that older adults are concerned with finances, family, national politics, world events, issues in the community, the health of their pets, all kinds of personal interests. Older adults are often the most active volunteers and supporters of environmental preservation, quality education, and helping the disadvantaged. Aging is a mental I call it a mental chess game. You just have to remain positive. And by remaining positive in your thinking and doing things that you think are important, you're never going to feel old or over the hill. And one of those things about positive thinking is also taking positive steps to prevent disease and illness. And because this is being taped in the fall, it's on my mind today, I want to encourage you to prevent flu. And so primary prevention is important. Get a flu shot. Flu results in over 42 million hospitalizations annually, and only 60% of older adults are vaccinated. Influenza is a contagious respiratory virus that can cause mild to severe illness, and older adults are among the people who are at highest risk for serious flu complications. Why take the risk? Get vaccinated. And while you're there getting your flu shot, why don't you get a pneumonia shot or pneumonia vaccination? We know that they can prevent up to 80% of pneumonia-related deaths. And the efficacy of the pneumonia vaccination prevents about 56 to 81% of viral infections. You are worth it. Take care of yourself. Get vaccinated. Oh, here's number two myth. Yep, your brain power declines. Well, that's not true. One of the things that we want to encourage you to do is to use your brain. You know, in the whole area of brain health, we are shifting how we address cognitive impairment. What we want to do is prevent and delay memory decline instead of focusing on just treatment. We know today that there's 5.2 million people in the United States who have been diagnosed with Alzheimer's disease, and that number is tripling or expected to triple by 2050. What can you do? What can you do to keep your brain healthy? Well, we've talked about a lot of that stuff. Eating a healthy diet, cut the sugar intake and the carbohydrates, reduce your saturated fat in your diet by 10 to 15%. Eat lean protein, reduce that animal meat, especially the beef. Exercise, move. The more the better. One of the things we've seen in the research is you should take up a musical instrument and learn how to play. The research has shown that playing a musical instrument delays the onset of cognitive and auditory decline. But what goes on in the brain and why that occurs, we still haven't figured out. But start playing the piano. Eat berries. As interesting as it is, we found that eating berries can improve short-term memory. The reason? Potent antioxidant qualities. Other fruits with high antioxidant qualities are prunes, raisins, blackberries, strawberries, raspberries, plums, oranges, red grapes, and cherries. Research is showing to help keep your brain healthy, you need to drink some coffee and have moderate alcohol intake. Moderate meaning 1 drink of 6 to 8 ounces for a woman and 2 drinks for a man. Vitamin B12 and folate are also vitamins that help with your brain. Where do you get that? Lean beef, skim milk, shellfish, and eggs. Research has shown you should reduce copper in your diet, and that would include decreasing foods such as liver, clams, and oysters. In October of 2006, Neurology published a research study that looked at 4,000 older adults greater than 65 years of age over 6 years. And they showed in the results section that eating 2 or more vegetables a day slowed a person's mental decline by 40%. 2 or more vegetables a day slowed a person's mental decline by 40%. People who ate 3 servings a day, that actually equivalated to 5 years of younger age. So what vegetables did they see the most benefit with? You've heard this before, but let me say it again. Green leafy vegetables, especially kale, collard greens, and spinach. Next in the hierarchy of vegetable eating were carrots, squash, and yellow vegetables. The third in the hierarchy, broccoli and Brussels sprouts, and the fourth, red peppers. So another myth. I'm going to be stuck with bad habits. I can't change. And this sort of goes to my last myth slide, which we'll talk about in a little bit, but it's control your own destiny. What 4 changes could you make over the next couple of months that would make a positive impact on successfully aging? Let's go through some things that you could do. 4 simple things. First of all, throw your scale away. Don't weigh yourself every day. Buy a tape measure. Start measuring your waistline. If you're a man, you want your waistline below 40 inches. And if you're a woman, below 35 inches or less. We know that if you keep your waist, men, below 40 inches and women below 35 inches, you have reduced subcutaneous abdominal fat and the fat around your liver. Why? Well, high amounts of fat in your abdomen are related to metabolic syndrome, excess abdominal fat, insulin resistance, glucose metabolism, bad lipids, high blood pressure. We also know that metabolic syndrome can lead to type 2 diabetes mellitus, hypertension, the dyslipidemia, pain and arthritis in your knees from the weight of your body. Pulmonary disorders also occur with obesity. You get hypoventilation syndrome or obstructive sleep apnea. The weight in your abdomen can cause urinary incontinence. It's not known whether obesity or metabolic syndrome cause this, but people who are obese have a higher risk of cataracts. And there's 10 different cancers associated with having a big stomach. Cancers such as breast cancer, colon cancer, gallbladder cancer, pancreas, renal, bladder, uterine, cervical, and prostate cancer. So start measuring your waist. Set realistic goals. It's going to take time. And as we age, remember, small changes have big effect. So what you're going to see in a couple slides is I've pulled out some great apps that you can go to that will help you measure and plot over time some of these different things. For example, one of the apps is called Lose It. It creates food and exercise logs, daily calorie allowance. It subtracts your workouts, calories move in real time. There's other ones where you can actually interact with other people, and these are free on your Android and iPhones. The Fitacrits play against each other to just motivate each other to do well each day and to stay strong while they're going through their changes. What's some other things we can do? Stop smoking. It's bad for you. Only moderate alcohol. We know that 1 drink for women and 2 drinks for men is good, but taking too much alcohol actually becomes deleterious. So keep it to 1 for women, 2 for men. And we've said it before, move, move, move. Even if you're watching TV, get up at the commercials, just move around. Any kind of movement can help. Number 4, your happiness will decline. Wrong. Multiple studies have shown happiness increases with age and persists throughout most of your aging years. Life review is the key. You're going to have to adjust to changes, as loss is a key element of successful aging and happiness. You've got to continually make psychological adjustments. You need to develop a sense of satisfaction with your accomplishments. Enjoy the advantages that come with being older. Your time with grandkids, a different pace of life, pursuing a second career or a volunteer job that you've always wanted to do but never have had time to do. You have now the ability to choose how you spend your time and what you do with your time and how you make an impact. Develop a new sense of serenity, and with that ability, enjoy each day as it comes. Just remember what the research says. Happiness increases with age and persists throughout most of your aging years. I'm not going to spend too much time on number 5. You'll stop learning and growing. The only reason you stop learning and growing is because you choose to do it. Continue to read, to get involved, to have academic interest, and to learn new things. It's very healthy for your brain. It's healthy for you to have those kinds of discussions and learning. Go to the theater, enjoy the arts. You never stop learning and growing unless you choose to do it. Myth number 6 is that frailty is inevitable. Frailty is an impairment in function and a reduction in physiological reserves that cause disability. And you sort of know frailty when you see it. The person looks weak, they walk slow, have low physical activity, they seem to be exhausted, have a mental cloudiness, and they look fragile. The research says that this is not inevitable. Dr. Dorothy Dunlap in the Journal of Physical Activity and Health actually studied 2,286 adults aged 60 and older, and she found that every hour spent sitting was linked with doubling disability risks. Every hour spent sitting was linked with doubling disability risks, and despite the amount of planned moderate exercise the person had. Sitting research is telling us it's detrimental to our species. You've got to move. Dr. Seguin evaluated the data from the Women's Health Initiative observation study, and she specifically looked at 92,234 older adults aged 50 to 79. That's a lot of people. And what did she find? That over a mean of 12-year follow-up, women reporting 11 hours of sedentary time per day. This is sitting. Now, we're not counting sleep. These are people that actually sit for 11 hours a day, had a 12% increase in all-cause premature death compared to women who reported 4 hours or less of inactivity, regardless of physical mobility and function, chronic disease state, demographic factors, and overall fitness. We have to move. If you don't want to be frail, move. The most sedentary women had a 13% greater risk of cardiovascular disease, a 27% greater risk of coronary heart disease, and a 21% greater risk of getting cancer. So this was published in the American Journal of Preventive Medicine. Certainly tells us what we need to know. Move, move, move will keep you healthy. Lastly, your destiny is out of your control. Absolutely not. Unless you're hit by a bus or lightning, you have no control over that. But if that doesn't happen, you do have control. As we age, it's so important that you recognize that changes today make big differences in later in life. So I hope that what we've talked about today, about exercising, food as medicine, saying no to drugs, becoming part of a religious organization or socialization, really becoming active and planning out what your third age is going to be, all help you have a healthy and successful life. Thank you so much for listening to me today, and thank you for what you're doing to contribute in your retirement age to the greater part of our society. Have a great day and get moving.